So it looks like the doctor has ordered rehydration and antibiotic therapy for IV needed in room 1. So I'm going to go ahead and check the MAR, make sure all the orders look correct. Go ahead and do my 5 rights of right medication, right dose, right time, right route, right patient, right documentation. I've done the math, figured out my drops per minute, so it'll be 28 drops per minute. Once I get this set up, so I'm going to go ahead and just wash my hands here real quick and then get my IV set up before I head to the patient's room. And I'm just going to check my bag, make sure that there's no leaks, no cracks, that there's no particles hanging in it. And we'll go ahead and get started setting it up. Alright, so as long as we keep this sterile, I'll spike my bag. And hang it. Then I would have locked my IV here before I started so we don't get air bubbles in it. And prime it about halfway. We're almost done here. We've got one more air bubble to get out here. Perfect. Alright, so this is all ready to go. And I'm going to go ahead and mark my sticker. We want to change this within 72 hours, so I'll put my information on there when I started it and the date and when it expires, and we need to change it. Okay, so this is all ready here. Now I'm just going to grab my stuff and go start the IV. Oh, before that I would actually label my bag here, and this just has the drops per minute and then how many hours I'm hanging it for, which is 6 hours. So I've got that all calculated out here. We'll just line that up with where the fluids start. Okay, so I'll gather my supplies here. Again, check the MAR for the order. We've already done that here to start the IV, so we're going to head to Miss Needed's room. Knock. Hi, Ivy. My name is Lee. I'm your nurse today, and it looks like the doctor has ordered an IV to get started with some rehydration and antibiotic therapy. Can you verify your last name and your date of birth?
Needed 6/2 of 88.
Perfect, thank you. All right, so I'm going to wash my hands here. And first I want to set up a pad underneath so I don't, if there's a little blood loss there, we don't drip it all over the bed and the clothes. Get everything kind of set up here so I don't take too long after we get her poked. Okay, I think we're ready to go here. Just gonna feel around and see if I can find a good vein here. We don't want to go in the antecubital if we can help it because it's a sore area as we bend that a lot. So I think I found my vein here. Wash with alcohol, trying to get that blood flowing, and then I'm also going to wash the tips of my fingers since I've touched without that. Give that just a moment to dry and get this ready. Alright, and I would raise the bed at this point. I'm just going to sit down here so I'm at a good working level. Alright, here we go. Pull down on the vein here and insert. Little poke, and we're in. Going just a little further. And flick it in. Hold down. That goes in the sharps here. Hold a little bit of pressure at the end while we get this inserted. And I had my flash of blood, so we're good there. Now I'm going to go ahead and release. Let the pressure off. Chevron it here real quick. Stick there. Alright, how is that, Ivy?
It's good.
Okay, I'm just going to flush out here. Just do a few cc's here of saline. Make sure there's no infiltration. Make sure I made it in the vein. Alright. So disconnect that here, and now we're going to get the IV hooked up and going. And this is still sterile since I kept my cap on. And I would just alcohol this just to be safe in case it's touched anything from now to then. Okay, so we've got our IV all hooked up. Now I'm going to get it supported here. here. Go right over so we are able to see the port and make sure that it doesn't get infected or anything like that. Okay. Alright, so we're all hooked up here now. We're just going to get the IV flowing and make sure that it's to the appropriate drop. Great. And make sure all of our... Alright, let's get going here. So we want 28 drops per minute, so that's about 7 seconds, or 7 drops in about 15 seconds, just for my timing purposes. Just kind of hold it here, open it up. Slow it down just a little bit, it's just a little fast. There we go. Alright, so we've got it flowing here. We're all set. Are you doing okay, Ivy?
Yep.
Great. Okay, I'm going to lower your bed. I'm going to give you your call light. Is there anything else I can get for you right now?
No, thank you.
Okay, so I'm just going to clean up my mess here. And I'll get out of your hair. Wash my hands as I leave. I'm going to go document how the patient took it, what arm I put it in, what solution we've got going, and how fast. Alright, we'll be back a little later to start those antibiotics.
Thank you.